Yes, Shubham, start the session.
Yes, thank you, Dr. Priyam Dashpurkaisto, on just because of my inviting, and he is here with our Travis webinar. Thank you, all of my honorable doctors who are present in this session. So good evening. One more thing, this Dr. Priyam Dashpurka is also our prescriber of ECLOC and as well as Travis, and other brand are also there. He is very much supported me in my headquarter. So this session is for Travis. So I just requesting to Dr. Priyam Dashpurka to please take over.
Thank you, Shubham, for giving me the honor, and thank you also Kedula Pharma for inviting me and giving me honor to speak on behalf of their novel rabies vaccine, which is TH rabies. So I'm going to start my session. As you have know, the rabies is a public health challenge in India. Globally, about 15,000 human deaths are occurring annually, which is highest in India. India had more than 20,000 human deaths a year from rabies, accounting for 60% of the rabies deaths in Asia and 35% globally. 99% of deaths in India occurred in rural areas. As we are coming to the basic management, how we will manage the rabies bite own patients. First, we will come with the local own treatment, which is the first aid. Then we'll go for the active immunization, which is the vaccine, and after that, we'll go for the passive immunization, which is rabies immunoglobulin. Most of the cases, we don't give active immunization. We go for most probably local wound treatment, and after that, we got passive immunization. Now there are some currently we are facing some challenges in giving post exposure prophylaxis. That is which we are giving after patients are arriving in our institutions or hospital after getting bite from dogs, cats, or bats, or all the things. Now, the most challenges we are getting from in post-exposure prophylaxis non-compliance. Patients are coming for as the standard WHO standards dose. We are giving 5 dose vaccines in 0, 3, 7, 14, 21. Most of the cases we have seen that after 2 to 3 doses, after the completion of 2 to 3 doses, patients are not coming in institution or going to any pharmacy or for taking the rest of the vaccine, though we are mostly facing the non-compliance, that patients are not completing the complete treatment. And another thing that the most of the WHO vaccines are most of the inactive vaccines, which are more than 50 years old technology, which is now inconsistency and potency, stability. Ability is also short supply. In short supply, not short supply in government supply, they are, but in private settings we have short supply of vaccines. So, and most of the cases they are coming with some adverse event. Now, currently we have vaccines which are cell culture vaccines. Uh, there are some studies which are showing the limitations to 4 dose recommendation, WHO recommendation, which are done in some travel clinic, which is retrospective analysis, which is done in some travel clinic, which comprises of 110 patients who receive 4 doses of post-exposure prophylaxis. There are some shortcomings in the management of these patients where late initiation of rabies post-exposure prophylaxis in travelers, administration of immunoglobulins, and antibody levels less than 0.5 international per ml in 6 of 90 patients, that is 6.7% after 4 doses of vaccine. From that, we can conclude that patients who do not always receive optimal rabies post-exposure prophylaxis under real-life conditions. A significant proportion of patients did not develop adequate antibody levels after 4 doses of vaccines. Which is there are another study of non-compliance to 5 dose vaccine proven because of that. Most of the studies showed that outcome has come that hospital survived more than 16 days but died after 1 day of due to LAMA, or LAMA means live against medical advice. The reason of death may be due to lack of administration of rabies immunoglobulins, or there are some poor compliance to vaccination. Another article has come to compliance to post-exposure prophylaxis among animal patients, a hospital immunology study, which was done at Sapardan Hospital, New Delhi, which comprises about 360 animal patients, which showed that 53% were non-compliant to full course of anti-rabies vaccine. Another study which was done in Municipal Corporation Hospital, Bangalore, which comprises of more about 215 animal patients. One dose of rabies vaccine administered intramuscular on days 0, 3, 7, 14, 20, as I earlier said. The compliance rate after the study, that compliance rate came about 60%, which is low. Now there are coming to the evolution of rabies vaccine. In 1815, we have live attenuated vaccine, which was given in the spinal cord. In 911, we have come up with 1900 inactivated vaccine. In 1976, we have come up with cell culture, this is inactivated vaccine. Meeting the unmet need, we introducing a novel vaccine with simple and shorter regimen. Coming to the Cadila Pharma Nobel 3 recombinant rabies G14 vaccine, which is the first protein subunit vaccine prepared from VLP platform technology, first vaccine with 3-dose intramuscular regimen. The first vaccine with 3-dose intramuscular regimen 0, 3, and 7, where the WHO 5-dose regimen of 0, 3, 7, 14, and 21 days. After the 3-dose introduction of 3-dose intramuscular vaccine, we have come up with better compliance due to easy flow of regimen and less visit. Convenience, ready to use, no reconstitution required needed for that. There are some data on BLP technology. There are some clinical phase study design which was done most probably in some Indian continent. Another study, safety and immunogenicity of novel T vaccine, rabies G14 administered stimulated post-exposure immunization, randomized comparative control multi-center phase 3 clinical study. The results which came up after the some studies, the results are consistent across different groups and genders. Observed difference are about 1.52% with the p-specific margin of less than non-inferiority of seroprotection. Primary endpoint test and comparative seroprotection are both on days 14 and 42 for days 14 and 42. After they came at that novel 3 has dose has a better safety profile as compared to other reference vaccines. Study after all the studies, we can conclude that novel 3 dose was non-inferior to reference vaccine. There are less adverse effects compared to reference vaccine. Novel 3 vaccine was found to be safer, immunogenic, and comparable to 5-dose WHO pre-qualified vaccine. The THC vaccines have received some awards, which are the Pharma Innovation of the Year by the Economic Times, Innovative Product of the Year by the Global Golden Globe Tigers Award, Malaysia. Thank you.
Uh, uh, Thank you. Thank you, sir. Many, many thanks for your to give me for your valuable time, sir. So I need to support to serve our society with our 3 doses compared to 5 doses available in the market. So it's my request to you once again, sir, to continue and thank you for your kind support. That's all, sir. Thank you.
Tech support, please conclude the session.
Okay.